So, choriocarcinoma is a highly malignant tumor arising from the chronic epithelium. Just because it is a tumor that arises from the chronic epithelium. That's why I was discussing about the layers of the uterus, musculature of the uterus, that is epithelium, mesothelium. So, about 50% of all the patients with the molar pregnancies or hereditary form moles develops choriocarcinoma. Molar pregnancy here the mole-like structures are there, that is along with pregnancy or other than that, and hereditary form mole that we will discuss in further classes. So in 50% of the cases it is associated with the molar pregnancy or hereditary form moles, and in 30% it occurs after the miscarriage or an ectopic pregnancy. So the condition is related to the pregnancy. When a female or when a uterus carry any fertilized part, that is ovum and sperm, and it continues towards the pregnancy, so it might be the cases it is reacted as a foreign body. Pregnancy itself is called as a fastest growing tumor. Within 9 months it grows to the 3 kg. So it is an external or part or any foreign part that is growing inside the womb or the uterus of a female. So many of the times, due to any problems or severe conditions, the molar pregnancies or hereditary form moles are formed, and associated with that or other than that, choriocarcinoma is also there. So in 50% it is associated with the molar pregnancies or hereditary form mole. In 30% it occurs after a miscarriage or ectopic pregnancy. So both of these are the abnormal conditions, and in 20% after apparently normal pregnancy. So it is mostly associated with the pregnancy, and it in rare of the rarest cases it can be without pregnancy, but most of the time it is associated with the pregnancy. So what's the site? Anywhere in the uterus, and rarely it starts in the tuber ovary. So chances to be there in the fallopian tube or ovaries are rare of the rarest, and most of the time the musculature of the uterus. So how it appears? The lesion is usually localized nodular type. The nodule type may be located depth in the myometrium with overlying endometrium intact. So in the layers of the uterus, it may penetrate beneath the myometrium, and many of the time it is in between layers, and both the sides are intact, and we generally don't know what is happening, and it outbursts after the severe condition. So the lesion is usually localized. It is a nodule-like structures in the musculature of the uterus, and this nodular type may be located deep in the myometrium with overlying endometrium intact. Endometrium is intact. In the radio imaging techniques, with using that, we can't with the normal techniques we can't go beneath the myometrial layers. We need much advanced technique. In regular checkups, we see, yes, endometrium is intact. The reason of the bleeding or other complaints, associated complaints, we can't find out. But with the advanced techniques, when we go beneath the myometrium, then it is find out, or when the condition is worsened, it can be represented. It looks that hemorrhagic and necrotic even. At times, the lesion is diffuse, involving the entire endometrium. With the time, it is first it is nodular like, एक node like रहता है myometrium पे, and later it is diffused to the whole endometrium. So what's the appearance? About the microscopic appearance, the slide is not here in the in this presentation. In the end of the class, I will show you the microscopic appearance of the choriocarcinoma. There is the anaplastic sheet or column of the trophoblastic cells invading the uterine musculature. Cell types changes into the trophoblastic cells. and it invades the uterine musculature. And evidence of the necrosis and hemorrhage means what is necrosis? That is a decaying of the cell, किसी चीज का सड़ना kind of, and hemorrhage and bleeding, मतलब कि the musculature of the endometrium or myometrium, it is the smooth normal muscle like structure. मसल्स में आपको eruptions या necrosis या hemorrhage scenes नहीं आएंगे, but here in the musculature even some part is seen like a necrosed, and some is hemorrhagic. Or can I share that slide here now only? And villus pattern is completely absent. Actually, I didn't download it now. It's in my WhatsApp. And the villi of the normal musculature for the transportation. So all these are damaged, and villus pattern is completely absent. Evidence of necrosis and hemorrhage, and there is anaplastic sheets or columns of trophoblastic cells invading the uterine musculature. The normal musculature is totally disturbed here. So how it spreads? Local spread is common, and in the local, as we discussed, first it is a nodule form, and gradually it becomes diffused. So local spread is common, and vascular erosion through the blood vessels takes place early, and hence distant metastasis occurs rapidly. So from the vascular channels, distant metastasis is also a rapid process. The common sites of metastasis are lungs in 80% of the cases, and 30% of the cases towards the anterior vaginal wall, and in brain and liver, 10% of chances to be metastasis of these cells. And how it is represented? What are the clinical features? Persistent ill health means the lady will say, I'm not feeling well. She will feel lethargic or lack of desire to do anything. So, and health is also depriving day by day. And the most alarming sign, that is irregular vaginal bleeding and at time rest. So something brownish or dirty discharge is continued through the vaginal portion is commonly seen. And along with that, continued amenorrhea, that normal cycle is not there. Many of the time, irregular vaginal bleeding uh, is there, and with the sequence of amenorrhea. So these are the common symptoms, and other symptoms due to metastatic lesion. So when it is towards the uterus, so persistent ill health with irregular bleeding and amenorrhea. These are the symptoms, and with the metastasis, the symptoms of the other parts are also there. Like when it goes towards the lungs, then cough, breathlessness, hemoptysis. These are the symptoms. In the vagina, irregular it is, and sometimes the brisk hemorrhage. Some discomfort is there, and with the episodes of the brisk hemorrhage, it is common in the vaginal and uterus. So it is the symptoms. This symptom is there in the uterus and in the vagina. That is of the brisk hemorrhage or bleeding. And in the cerebral, headache, conversion, paralysis, or even coma. And in the when it is in the liver, then gastric pain and jaundice. And when all of these symptoms comes, it is very important to diagnose at the time. Now, what are the signs? Patient looks ill, pallor of varying degrees. Bimanual examination reveals subinvolution of the uterus. We see the on the bimanual examination, feel the cervix, but it feel like this. It is involuted inside. So on bimanual examination, uterus is palpable as subinvolution, and there may be purplish red nodule in the lower third of the anterior vaginal wall. So it might be due to that hemorrhagic pattern, that purplish red nodule in the lower third of the anterior vaginal wall is there. So these are the signs and symptoms. That is mostly due to the some normal musculature is disturbed, some cells are necrosed, that is decaying, and when it is decayed and the normal pattern, it is aplastic, normal blood supply and flow is disturbed, and these cells are affecting the associated cells even. So either it is in the uterus or any other parts, normal work of the organ is hampered, and body is associated, each and every organs are associated. So मतलब घर का एक सदस्य भी अगर बीमार पड़ता है तो बाकी पूरी फैमिली डिस्टर्ब हो जाती है. तो if it is metastatized or not, after metastasis the condition is worsened, but if it is up to the uterus also, the patient will feel ill. And due to the, as we discussed about the, yes, vascular erosions uh, are there. So when the vascular erosions are there, the episodes of bleedings are there. So these spread and symptoms, what is the work, are correlated, and these represent as the clinical features. So ill health is there, and vaginal bleeding is there, and a normal cycle is disturbed here. So there is no normal menstruation that is common. So uh, episodes of amenorrhea with irregular bleeding at times. So these are the symptoms. Now, according to the stages,
Ma'am,
yes,
ma'am, why the symptoms like paralysis, coma, and all
that are
convulsions can be
that are in the brain. When metastasis goes towards the brain,
brain?
that is cerebral structures, then suppose a part of the brain is cells are enlarging in the number, being necrosed, some hemorrhagic pattern is there that block the other vascular supply or block the any important part of the brain. So a pressure is there at the part of the brain. So headache is there. That is palpating, and necrosis is there that may result in convulsion and paralysis. And when a severe, under the severe conditions, when all these changes are affecting at a large level, then it might be possible to go towards the coma. It is about the metastasis, which organ is involved, that is being affected, and the symptoms related to that will appear, like in the liver, epigastric pain, and the symptoms of the jaundice are there. In the vaginal, it is similar to the uterus, that irregular and time risk hemorrhage. And when it goes towards the lung, then cough, breathlessness, and hemoptysis, these are the symptoms related to the lungs. So that will according to metastasis with that to where it is. So
Okay, ma'am. Thank you.
as per the stages, the lesion is confined to the uterus, then it is stage 1. In stage 2, lesions spread outside the uterus but confined to the genital organs, like up to the vagina only. And in the stage 3, it goes up to the lungs. And in the stage 4, the metastasis is severe up to the brain, liver, or GI tract. Then it is said as stage 4. And about the treatment part, it is uh, approximately, not we can say 100% curable, but in most of the cases it is curable with the therapies like the chemotherapy and other. If it is localized, it is stage 1 is there up to the uterus only, then it can be evacuated. And if it is metastasis is there, then the therapies are very much effective in that. So if it is diagnosed at the stage 1 or stage 2, the chances of recovery is uh, you can say, matlab you can in a simple cuff you can't say it is 100%, but yes, in most of the cases it is seen that the recovery is quite possible. And we have to select the stage and that type of the tumor, that where it is. If it is localized, then evacuation of the contents from the uterus is very common, or surgeries are there. And if it metastasis is there, then chemotherapy will definitely be helpful. And the most important thing is to diagnose that at the right time. So we can't have to take the everything as so casually or normally that bleeding is there. And in these cancers, specific kind of pungent smell that is in clinical experiences, it is not there in the slides. A different kind of smell that is other than the normal breathing you can feel, or the smell from the patient, that is different. uh, Gradual exposure, with the gradual exposure of different kind of cases, you can see that due to the when it is metastasis is there, it is severe. So then so you will the appearance is typical kind of lean and thin patient with some dyspnea like symptoms that वो एकदम बीमार type का. At the age of 40 it looks like 80. And along with that, the show uh, and some history of the like any abortions, ectopic pregnancy, or molar pregnancies, these are there in the history, then it should be referred to the oncology department or the proper diagnosis. If it is possible by your side, then you have to be do, or you have to refer to the oncology department for the cure of the patient. So all these about the choriocarcinoma. And if you have any queries or questions, you can ask. And in the next topic, we will discuss about the molar pregnancy. And it is also a condition associated with the pregnancy. In the pregnancy, similar kind of changes here also in the molar pregnancy. Here we see that 50% of the patient with the molar pregnancy or hydatiform mole develops choriocarcinoma. That in the uterine layers, a mole-like structure is formed, and like the bunch of grapes, you can see the moles are attached, and that will give the appearance of grapes. And in many of the times, the pregnancy and these moles continue, and with the proper surgical care, the live uterus is taken out. But in some of the cases, it may hamper the pregnancy. So these conditions like hydatiform mole or molar pregnancies or choriocarcinoma are the conditions. And the reason is not exactly clear. Some of the genetic or chromosomal level changes are definitely there, and many of the time these changes are due to the or due to these changes, it's reason or cause that is not very sure till the scientific discoveries. But it is thought that it are these are the associated symptoms, like body is taking the pregnancy as an any external evidence. Like when an organism invade your body, the TLCs will raise, and that will kill that organism. That is your normal immunity process. So here also the body with the increasing or the coming fetus, body will take it as an any external part or organ, and the immune mechanism is hyperactive, and some of the changes it may be up to the genetic level, but it take it as an external organ, and the change in that myometrium and endometrium, all these are due to uh, uh, kill or damage or get rid of that external part. That is not exactly, but it is uh, it will take it that like external part, and these continue, and it is metastatic also. Metastatic and malignant kind of tumor, that is if it is not cured, it may be the life threatening. So any queries or questions, or you I'll show you
Ma'am, what the
those slides
statement
even.
is, madam?
Treatment
What
is
statement?
if it is a treatment,
Yeah, but the treatment, is there any
yes,
way in naturopathy and Ayurveda or only in chemotherapy, which is
no, till now, if it is there from early stages, we have to, before that we can take that, we have to make our system very strong to differentiate between the natural and normal and abnormal things. So before conceiving or before this tumor, we can make our body very strong and active with the procedures like yoga and all the therapies. But after the tumor, we can't evacuate that. Yes, surgical procedures in the Ayurveda is there, and we can opt for that. But the procedures are same. We have to cut the layers and take out that abnormal part. And if it is metastatized, then some of the Arbudnashan therapies treatments are there, but at the date now, there is no research is done on this. So with guarantee, we can't say that, but we can give the supportive treatment like with the breathlessness and other symptoms. We can add the pranayam and the yoga therapies to have the balanced life. But it is not the cure. It is the supportive treatment to reduce the symptoms, to help in the symptoms. But for that, chemotherapy is the treatment of choice till date. Yes, definitely. If work will be done, and it needs the team support of, we don't have to differentiate between the pathies. We have to treat the cause, then we have to do that work in the collaborative and integrated way. Then might be some Arbudnashit drugs can affect on that even. But till date, the chemotherapy is the treatment of choice. And if it is up to uterus, then it may be evacuated with the surgical procedures. Any other query?
Ma'am, what are the investigations that we have to suggest, ma'am? And what would be the differential diagnosis between this and threatened abortion, ma'am?
Yes,
How can we differentiate?
first of all, yes, it's a good question, and we have to differentiate. First of all, we have to go to the normal sonography. Uh, some disturbed myometrial levels or endometrial level if it is up to the endometrium. And the first and last, we can say histopathology. In histopathology, the cell smear is made, and that pathologist will differentiate. That we discussed about the trophoblastic kind of cells. Generally, the cell pattern is changed. In that, the changed cell pattern with the enlarged nucleus or no nucleus, that is different from that of the common cell pattern of the uterus, of normal uterus. And the cell pattern of this choriocarcinoma cell that in in the slides, we discussed about the cell pattern. So the trophoblastic cells are there. Generally, three kinds of cells are there, and most common are the trophoblastic cells. Yes. Anaplastic sheets or columns of trophoblastic cells that are invading the uterine musculature. So on the histopathology, we will see that, and evidence of necrosis and hemorrhage and villus pattern are completely absent. So with the microscopic appearance, we will see all these changes in the pattern of the cells or the musculature, and we will go towards the diagnosis that it is choriocarcinoma, and the diagnosed or metastasized or not. So we have to invade the other organs also with the advanced techniques like PET. Now it is the latest version to diagnose the cancerous cells, that is positron emission technique. So we can go for that other scans like CT scans or CET, all that were used, and now PT is commonly used to see for the deep study of the cell structures. So we can use these diagnostic techniques. And any other query? I hope you all are satisfied with the answer, or if not, then I'll explain once more.
Ma'am, like FNAC and biopsy, if we are suggesting that, then which part of the FNAC we have to suggest, ma'am?
From the cavity only, we have to do the DNC, and the cell structures, we have to make the proper slides and make that in the media. We will have to send that to the labs, and there the pathologist will confirm the kind of cells or if any malignancy is there.
Okay, ma'am. Then pap smear would help here, no, ma'am?
Yes, it's a kind of procedure. Yes, pap smear is definitely help you in that. Similarly, and some other procedures are there, but like the pap smear, we have to take out the pattern of cells. But in pap smear, many of the time we take it from the fornices.